Hello everyone, we're going to be focusing on obsessive compulsive disorders in our DSM-5 today. Um, Obsessive compulsive disorders and related disorders include obsessive compulsive disorder, OCD, body dysmorphic disorder, hoarding disorder, trichomania, which is otherwise known as hair pulling disorder, excoriation, which is skin picking disorder, substance medication-induced obsessive compulsive disorders and related disorders, other specified obsessive compulsive and related disorder, and unspecified obsessive compulsive disorders. OCD is characterized by the presence of obsessions or compulsions, obsessions being defined as recurrent and persistent thoughts, urges, or images that are experienced as intrusive and unwanted, whereas compulsions are repetitive behaviors or mental acts that an individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. So there's also other preoccupations that go along with these terms as well. Again, I'm not going to read you everything from the book. It's a big book. But however, if you do feel like you have any of these symptoms or signs, warning signs, please go see a professional who has been certified so that you can get the proper diagnosis and treatment that you need. Obsessive compulsive disorder is the presence of obsessions or compulsions. Obsessions are defined by recurrent and persistent thoughts, urges, or images that are experienced at some point in time during a disturbance as intrusive and unwanted that causes most individuals marked distress or anxiety. Individual attempts to ignore these thoughts, urges, or images to neutralize them with some other thought or action. Compulsions are defined by repetitive behaviors such as hand washing, ordering, checking, or mental acts such as praying, counting, or repeating words silently that the individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. This person experiences these behaviors or mental acts that are aimed at preventing or reducing anxiety or preventing some dreaded event. However, these acts are not connected in a realistic way with what they are designed to neutralize or prevent or clearly excessive. Obsession or compulsions are time-consuming, more than 1 hour a day, that causes clinically significant distress or impairment in social, occupational, or other important area of functioning. It is not attributed to a psychological effect of a substance and not better explained by another mental disorder. Here we have specifiers if there's good insight, poor insight, or absent insight. Some of you might be familiar with OCD behaviors with the TV show Monk, where you see him constantly washing his hands and checking things and making sure it's clean all the time. This is a really good example, and the media has been coming out with really good examples of what this looks like today as well. Feel free to look it up. Body dysmorphic disorder is a preoccupation with one or more perceived defects or flaws in physical appearance that are not observable or appear very slight to others. The individual has performed repeated behaviors such as mirror checking, excessive grooming, skin picking, or mental acts such as comparing their appearance to others. The preoccupation causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. And the appearance is not better explained by concerns with body fat or weight in an individual whose symptoms meet diagnostic criteria for an eating disorder. So there's muscle dysphoria, which is a specifier in body dysmorphic disorder, where the individual is preoccupied with the idea that his or her body is too small or insufficiently muscular. When the individual is preoccupied with other body areas, which is often the case. It also has a specifier with good, fair insight, poor insight, or absent insight with delusional beliefs. Body dysmorphic disorder is a really serious disorder. It actually occurs in 1 in 50 people here in the United States. And people who struggle with body dysmorphic disorder have a suicide rate that is 30 times that of the national average, which is very high. And only 5% of these people with body dysmorphic disorder actually get treatment, which means that their lifetime of stress and not getting help is going to be a lot higher. And also risk of death and dying early just because of the stress. There's a movie called Ugly Me, My Life with Body Dysmorphic Disorder. I'm going to do my best to play the intro for you guys now so you can get a clear idea of what this is and what I'm talking about. Please, if you have anyone with these sorts of negative thoughts, to assist them to get some help, as obviously suicide rates are very serious and we take these threats very seriously. So please help them get help as needed. And of course, the authorities are here to help us. So if you ever hear anyone, just call 911 and they will escort that person to their local mental health facility to get treatment. Hoarding disorders is in our obsessive compulsive disorders here. And this is persistent difficulty discarding or parting with possessions, regardless of their actual value. This difficulty is due to perceived need to save the items and to stress associated with discarding them. The difficulty discarding possessions results in the accumulation of possessions that congest and clutter active living areas and substantially compromises their intended use. If living areas are uncluttered, it is only because of interventions of third parties such as partners, family members, or close friends. The hoarding causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. The hoarding is not attributed to another medical condition and not better explained by another mental disorder. Specifications here are excessive acquisition. Difficulty discarding possessions is accompanied by excessive acquisition of items that are not needed or for which there is no space. Good fair insight, poor insight, and absent insight. Hoarding disorder is a very interesting disorder. I'm sure many of you have seen the TV show called Hoarding, and this is a one-time fix-it method, and it does not have long-term effects at all with people with hoarding disorder. It's really important that they have the mental health treatment that goes along with it, because some of these people are dealing with trauma that goes all the way back into their childhood, and these things need to get resolved mentally in order for it to come out physically into their day-to-day lives. So most of these people are going to go back into their hoarding situations because the mental health aspect has not been met, and it was essentially forced upon them by family members or people around them. So this process takes patience, and it takes a professional to really know what they're doing and to work with people specifically with hoarding disorder. Trichomania. This is defined as recurring pulling out of one's hair resulting in hair loss. Repeated attempts to decrease or stop the hair pulling. Hair pulling causes clinically significant distress in important areas of functioning, and it's not attributed to another medical condition, such as a dermatological condition, and not better explained by another mental disorder. Trichotillomania is actually more common than you would think. Celebrities such as Katy Perry has suffered from trichotillomania, and it's mostly common in girls from age 14 and up, but it can also occur in males, and celebrities such as Leonardo DiCaprio has also suffered from trichotillomania. I personally have worked with a few clients that have this disorder, and I find it to be related to high anxiety and anxious thoughts. So seeing a therapist to work on these anxious thoughts will be your number one key tool. Excoriation or skin picking is a recurrent skin picking disorder resulting in skin lesions. Recurrent attempts at stopping or trying to decrease the skin picking, however unsuccessful, causes clinically significant distress, not attributed to psychological effects of a substance such as cocaine or another medical conditions like scabies, not better explained by another mental health disorder. For excoriation, skin picking disorder, This is not as common of a disorder. It happens in about 2 to 5% of our population, and it mostly occurs in children between the ages of 13 and 15. However, it also happens to adulthood and earlier ages. A lot of this will also occur from stress, peer pressure, image to look a certain way. So, again, seeing a therapist, having proper role models are going to be really important for kids to be raised in healthy environments with positive atmospheres so that they can be the best person they can be developmentally. Substance, medication induced obsessive compulsive and related disorders is defined by obsessions or compulsions of skin picking, hair pulling, or other bodily focused repetitive behaviors or other symptoms characterized by obsessive compulsive features and related disorders that predominate the clinical picture. There is evidence from the history, physical examination, or laboratory findings of both symptoms in criterion A developed during or soon after substance intoxication or withdrawal or after exposure to a medication. The involved substance/medication is capable of producing the symptoms in criterion A. Evidence of an independent obsessive compulsive and related disorders could include the following. If symptoms persist for over 1 month after cessation of the substance, the disturbance does not occur exclusively during the course of delirium. The disturbance causes clinically significant distress to their daily function. And you can specify if the onset happened during intoxication, during withdrawal, or after medication use. Obsessive compulsive disorders and related disorders due to another medical condition. Obsessive compulsion, skin picking, hair pulling, or other body focused repetitive behaviors or other symptoms characterized of the obsessive compulsive and related disorders predominate the clinical picture. Evidence from history, physical examination, or laboratory findings find that the disturbance is the direct pathological consequence of another medical condition, not better explained by another mental disorder, does not occur exclusively during the course of delirium, causes clinically significant distress, where the person is preoccupied with the disorder and it causes impairment to the other important areas of function. Here we specify if it's obsessive compulsive disorder-like symptoms, appearance preoccupation, hoarding symptoms, hair pulling symptoms, or skin picking symptoms. Finally, we have other specified obsessive compulsive and related disorders. Body dysmorphic disorder type with actual flaws, body dysmorphic-like without repetitive behaviors, body focused repetitive behavior disorders, obsessional jealousy, Subo Kyofu, which is excessive fear of having a body deformality, Koro, which is sudden and intense anxiety that the penis or nipples will recede into the body, possibly leading to death, and Jikoshu Kyofu, which is fear of offensive body odor. Finally, there's unspecified obsessive compulsive and related disorders. The next video will be on nutritional and lifestyle values to help with obsessive compulsive disorder, as well as some yoga and meditation techniques to also decrease obsessive compulsive tendencies. Please leave any comments or feedback on what you would like to see next, or if you have any questions that you feel like you relate to any of these, or if you know of someone and would like to have a little bit more information, or if you'd like to even focus on one area particularly where we can go a little bit deeper into that. Please feel free to reach out, comments, questions below, and I'll see you next time.